So I always tell my patients, you want to get the most bang for your buck when you get in to see your physician. So come prepared and talk to your family. See if there's anyone else in the family who has struggled with headaches as well. These are all clues that your physician will use to help manage your headaches. Headaches can actually be caused by any number of factors. Factors may be internal to the patient, him or herself, or they can be external and environmental. For example, life stressors are a big cause for tension-type headaches. Another example, which is very common for migraine-type headaches, are certain foods or changes in the weather. Migraine headaches are a type of headache. Headache is a broad umbrella term, and there are many different types of headaches, migraines being one specific kind. If you notice that you start having headaches or your usual headaches become more severe or more frequent, I always recommend getting in touch with your doctor. Great place to start is your primary care provider. They can evaluate you, run just basic tests, and send you where you need to go after that. So I always tell my patients, you want to get the most bang for your buck when you get in to see your physician. So come prepared with your medications lists, have written down all of your medical issues, past surgeries that you've had, and talk to your family. See if there's anyone else in the family who has struggled with headaches as well. These are all clues that your physician will use to help manage your headaches. When someone has headaches, I always ask, what are some triggers? And very commonly, people haven't really noticed. So as you prepare to see your doctor, I recommend keeping a headache log, and it could be something very simple like a calendar or a notebook. You just need to log the date and time of your headache and notice if there was any kind of inciting factor, anything different that day. I do have people track what they ate because you'd be surprised. Some foods will trigger your headaches and you had no idea. When someone comes into the hospital or clinic with a headache, there's going to be many questions that the doctor asks, both about the onset, the development of the headache, and different characteristics about the headache that will in turn guide the workup that is done. Some examples of workup are brain scans, blood tests, and always there's going to be a physical examination. All of these depend on what the physician is seeing when you come in. Misconceptions that I've heard about headaches, mainly people like to think that they are strong or tough and they don't want to seek help or they don't want to take a medication. We all have our values, and as a physician, I absolutely respect patient autonomy. However, it has nothing to do with toughness and everything to do with making your life better. So I sound like a broken record, but please go see your doctor, see what the options are. You may be surprised. Diagnosis and management of headaches is very often a work in progress. There's very seldomly going to be one magic change that you make or one magical medication. So when you come into the office, come prepared with all of your questions, come prepared with a log, and come prepared to just get into the weeds and be patient, because the goal is to manage your headaches, prevent them if possible, and sometimes that just takes time.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.